Mistakes made by hospitals are the third leading cause of death in the U.S. More than 400,000 people die every year from preventable mistakes. That has sparked pressure across the U.S. to install cameras in hospitals to protect patients. AeroSight is one of several companies providing camera systems to help. CEO Adam Aronson says that this system at the Long Island Jewish Medical Center is designed not just to catch mistakes, but to prevent them.
And what we're looking for are patient safety measures as well as sort of the process. What's the workflow of each and every operating room?
The technology works by sending a live video feed to remote auditors. To protect patients' confidentiality, images of patients are transmitted at low resolution so that faces cannot be identified. The auditors send back scores to monitors like these, stationed all around the hospital. They audit operating rooms every 2 minutes, equipment cleaning sinks every 15 minutes, and hallways every 30 to 60 minutes.
And the idea is twofold. One is to make it a lot easier for the whole team, the whole operating room teams all over the building really, to know exactly what's going on in every room all throughout the day.
The word team is crucial. Auditors report on the success or failure of teams, not individuals. If they see a serious mistake, they notify the team right away. They don't single out individuals for punishment. Instead, Aronson says the system sets up a friendly competition between teams to get the best scores.
Sort of the art of this type of very technical work is working with clients and helping them understand that if you kind of reverse engineer this and showcase the winners, measure excellence, create competition, and reward great work on an aggregate basis, you can completely diffuse any kind of anxiety on your staff front.
A British medical journal study of the AeroSight system here found that with video auditing, scores on surgical safety checklists quickly jumped from about 25% to more than 90%. Terminal cleaning compliance rates leaped from about 20% to about 100%. The BMJ study found efficiency improved too. Operating room turnover times jumped about 15%. That allowed the hospital to do more operations more quickly.
We're all under production pressure in healthcare.
Dr. John DeCapua is chairman of anesthesia at 3 Northwell Health hospitals, including Long Island Jewish. He's also a co-author of the BMJ study.
We got patients that want to come in. They like to get their cases started on time. We've got another case to follow. Turnover time, it's a very, very expensive environment. We're trying to be efficient with time. Society's asking us to be cost effective. And all of those production pressures get in the way or compete with safety behavior.
The camera systems also help the hospital comply with the Affordable Care Act, which rewards hospitals that achieve low infection rates and high patient satisfaction scores. Improvements in safety, efficiency, and satisfaction mean the AeroSight system has more than paid for itself.
A program like our RVA, Remote Video Auditing, gives us the ability to have a 300% return on investment.
Are there risks to this kind of video surveillance? Experts acknowledge that someone might try to force a hospital to save or turn over video, or that a hospital might try to use it to punish individuals.
We stressed this was a non-punitive study, and it was not for making an example of bad behavior, but rewarding good behavior. And we recognize the teams that do things the best, and then that momentum of pride for doing things well spread throughout the rest of the teams, and everybody wants to be in the winner's circle.
It turns out that most patients like the idea of having cameras in the operating room. In a survey of some 250 people, 80% said they would be interested in receiving a video of their procedure if a hospital was willing to provide it. For Newsweek, I'm Jessica Ferger in New York.